Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Bronchoscopy. Introduction. A bronchoscopy is a medical procedure that uses a scope to look inside your airways. It allows your healthcare provider to diagnose and, in some cases, treat problems. Your healthcare provider has recommended that you have a bronchoscopy. The decision to have this procedure is also yours. This program explains bronchoscopy. It discusses the benefits and risks and what to expect after the procedure. Anatomy. A bronchoscopy is a technique for looking inside the airways. The lungs allow us to fill our blood with oxygen. The air we breathe in comes in close contact with the blood in the lungs. When we breathe in, the air goes through the mouth and nose. From there it goes to the larynx, and then through the vocal cords to the air pipe, known as the trachea. From the trachea it goes into a number of increasingly smaller tubes called bronchial tubes. Small balloon-like sacs called alveoli are at the end of the bronchial tubes. The alveoli are thin, allowing oxygen to go into the blood and carbon dioxide to go from the blood to your lungs to be breathed out. The inner lining of the bronchial tubes secretes special substances called mucus. The mucus helps trap dirt from the air. Mucus is continuously expelled from the lungs. Small brushes, known as cilia, on the outside of the lung cells continuously push the mucus to the outside. Most of the time it is pushed automatically. If the mucus becomes too big, it can be coughed out. Bronchoscopy. Your healthcare provider uses a bronchoscope during bronchoscopy. A bronchoscope is a long, thin, and flexible fiber optic tube that transmits pictures from the tip to an eyepiece or to a video set. During a bronchoscopy, the bronchoscope is used to look at the larynx, trachea, and bronchial airways of the lungs. This procedure shows more details from the inside of the airways than pictures taken with X-rays. The bronchoscope has an open channel. This allows instruments to go through the scope and be used to take tissue samples, cauterize bleeding, or remove thick mucus blocking the airways. The healthcare provider that performs the bronchoscopy procedure is a pulmonologist, a specialist in the respiratory system. A bronchoscopy can be used to figure out the cause of many different respiratory tract symptoms. These include bleeding, chest pain, difficulty breathing, pain in the trachea, tumors. Clear and detailed images and video projected on a monitor helps your healthcare provider diagnose problems. In some cases, a bronchoscopy can be used to treat the problem. For instance, if a growth is obstructing breathing, it can be removed. A bronchoscopy can also be used to remove things that were accidentally inhaled into the airways. If any cancerous growths are found, they can also be taken out for further examination. This is called a biopsy. Biopsies are also done to test for certain bacteria that cause lung infections or pneumonia.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Preparation. A bronchoscopy is usually an outpatient procedure. This means you will go home after the procedure. It is done in a healthcare facility. You should not eat or drink anything within 6 to 12 hours of your scheduled procedure. Your healthcare provider will tell you how long you should stop eating or drinking. Food can cause vomiting during the procedure. If you are taking medication, ask your healthcare provider whether you should take them before the procedure. You should not smoke after midnight the day before the procedure. You should check with your healthcare provider about the use of aspirin or aspirin-containing products as well as over-the-counter pain medications before and immediately after the bronchoscopy. Taking such products can increase the risk of bleeding during or after the procedure. Blood-thinning medications may also have to be stopped for some time depending on what your healthcare provider expects to find or do during a bronchoscopy. After your procedure, your healthcare provider will tell you when it is safe to restart these medications. Tell your healthcare provider about any medical problems you have or if you are pregnant. For instance, bleeding problems or problems with the lungs and heart may require special treatment before, during, and after a bronchoscopy. Tell your healthcare provider about all the medications you are taking. Some patients may need to take antibiotics before the procedure. Tell your healthcare provider if you have any allergies. This will help your healthcare team select the right anesthetic for you. Anesthetics are medications that will numb you so you don't feel any pain. You will be asked to remove your shirt and put on a gown for the procedure. If you wear glasses, dentures, or partials, you will be asked to remove them before the procedure. You may want to bring an eyeglass case with you to put your glasses in. If you need one, a denture cup will be provided for you. If you are not having general anesthesia, you will go home the same day of the procedure. When you are ready to go home, you should not drive a car. Arrange for somebody to drive you home. Procedure. Before inserting the scope, your healthcare provider may spray a local anesthetic into your nose and mouth. This numbs your throat. If the bronchoscope will be inserted through your nose, your healthcare provider may also place an anesthetic in your nasal passages. The anesthetics start working within a few minutes. You may be given a medication that will help you relax. In this case, you will stay awake during the procedure. Try to relax and take slow, deep breaths through your nose. You may also be given medication that will put you to sleep. Every effort will be made to maintain your comfort and safety. Your blood pressure, pulse, and the oxygen level in your blood will be monitored. The procedure usually takes about 30 to 60 minutes to complete. You should feel no pain during the procedure, and you will be able to breathe on your own. You will feel the pressure of the bronchoscope as it is inserted. Some patients consider the test slightly uncomfortable, but different patients react differently to the procedure. Your healthcare provider will gently and slowly insert the bronchoscope through your mouth or nose and will move it to the vocal cords. More anesthetic will be sprayed through the bronchoscope to numb the vocal cords. You may be asked to make a high-pitched sound to help move the scope past your vocal cords. Do not talk while the bronchoscope is in your lungs. A large X-ray machine may be placed above you to send the X-ray pictures to a video monitor. The picture on the monitor helps your healthcare provider see clearly while the bronchoscope is moved through different sections of the lungs. The bronchoscope is then moved down your bronchial tubes to examine the lower air passages. If your healthcare provider sees suspicious tissue, he or she will take a sample for examination under the microscope. This is called a biopsy. Biopsies are helpful in examining abnormal growths to determine if they are cancerous. A biopsy needle may be used to obtain a sample of lung tissue. The biopsy results are usually available a few days later. At the end of the examination, your healthcare provider will withdraw the bronchoscope and you will be taken to a recovery room to wait for the effect of the anesthetic to wear off. This may take up to 1 hour. You will then be able to go home. Your healthcare provider may give you some preliminary results before discharge. If any biopsy was done, these results may not be available before a few days. When you are ready to go home, you should not drive a car. Arrange for somebody to drive you home. Risks. A bronchoscopy is a safe procedure. Complications are rare, but they can happen. You need to know about them just in case they happen. Some patients may be allergic to the sedative used. Tell your healthcare provider if you have any allergies before the procedure. This will help him or her pick the right sedative for you. Infection and bleeding could happen. Bleeding is rare, but it is more likely if a biopsy is performed or if you take blood thinning medication. If it happens, bleeding usually stops on its own. In rare cases, it may require a blood transfusion or surgery. A tear in the wall of the lung can occur during the needle biopsy. If this happens, air could flow into the membrane around the lung and cause a partial collapse of the lung. This is known as pneumothorax. If the pneumothorax causes breathing problems, your healthcare provider may have to put in a temporary chest tube. Spasms of the bronchial tubes can occur, which may make breathing difficult. Irregular heart rhythms or arrhythmias can also happen. X-rays are used during this procedure. The amount of radiation is deemed safe, but this amount could be dangerous for a fetus. It is important to tell your healthcare provider if you are pregnant before the procedure. Risks of general anesthesia include cut lips and chipped teeth, headache, nausea or vomiting, problems urinating, sore throat. More serious risks of general anesthesia include heart attacks, lung infections, strokes. Your anesthesiologist will discuss these risks with you and ask if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after general anesthesia. These usually show up a few days after the procedure. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs. There, they can cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if you experience symptoms of a blood clot. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of this complication. After the procedure. Though you will feel stronger after you go home, you should plan on resting for the remainder of the day. You may feel tired for a day or so after the procedure. This is normal. The medication used to numb your throat and mouth may leave you with a bitter taste in your mouth and throat. The medication may also give you a sensation of swelling in your tongue or the back of your mouth. This should not last more than a few hours. A sore throat and some hoarseness may last for a few days. Sucking on throat lozenges or gargling with warm salt water may help soothe your sore throat. Your healthcare provider will tell you how soon you can eat, drink, and resume your regular activities. Normally, you can eat after the numbing medication is worn off. It is best to try to drink water initially to make sure you do not choke on it. Call your healthcare provider immediately if you notice any of the following. You have difficulty breathing. You cough up more than 2 tablespoons of blood. You have a fever higher than 100.4 degrees Fahrenheit or 38 degrees Celsius that lasts for more than 24 hours.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A bronchoscopy is a medical procedure that uses a scope to look inside the airways. It allows your healthcare provider to diagnose and, in some cases, treat problems. During a bronchoscopy, the bronchoscope is used to look at the larynx, trachea, and bronchial airways of the lungs. A bronchoscopy can be used to figure out the cause of many different respiratory tract symptoms. These include pain in the trachea, difficulty breathing, bleeding, tumors, chest pain. Clear and detailed images and video projected on a monitor helps your healthcare provider diagnose problems. The bronchoscope has an open channel. This allows instruments to go through the scope and be used to take tissue samples, cauterize bleeding, or remove thick mucus blocking the airways. It is important to communicate with your healthcare provider about your health condition and the medications you are taking. You should also not eat or drink anything for 6 to 12 hours before the procedure. Some medical conditions, such as diabetes, will affect the length of time you may eat or drink. Check with your healthcare provider. Thanks to advances in medical technology, bronchoscopy allows a better diagnosis than X-rays. It can also be used instead of surgery to treat some medical conditions. Thank you for using Explain.